Hey friends, I'm Stephanie Carter Kelley, a physical therapist that uses yoga in just about everything I do. And one of the lessons in yoga that I've moved into my physical therapy practice is about using the right amount of effort. And so today we're going to use a magic pill of effort for your hips. So if you have hip pain, especially if you sit a lot during the day and then you get up from sitting and you find that your hips kind of hurt, maybe in the front and wrapping around to the sides, this is to give a little bit of exercise to activate some of those deep hip muscles that are supposed to be supporting the hips. But if you're sitting all day, they kind of go away and we need to bring them back. So this is a little dosage of exercise, and I call this the magic pill for hip pain. So the first thing you want is a strap. I have a yoga strap that when I create a loop in it, it's nice and tight. You can use a belt or anything that's not going to slip. And you're going to take that loop and put it around your thighs, so that when you tighten the loop, your thighs are coming directly out from your hips. So they're not too wide, they're not too narrow. And what I like to do then is maybe add a block in between the thighs, and then you can cinch that strap down. So I've got the block right in between my legs. You can kind of see here, right in between my legs. And that just, it's support. It gives you some feedback of how far those legs are supposed to be apart. So then you come down onto your back. You might want to test the loop, make sure it's not going to slip by pulling your legs apart a little bit. And as you come down onto your back, all we're really going to do is bridge. So you might know a bridge exercise. I teach a bridge exercise in my yoga classes as really using those glutes to lift the hips. And we're going to add a little bit more to that in order to fully engage the glutes and some other deep muscles that are important to support the hip joints. So press down through the arms, really push into the feet, make sure the feet aren't going to slip, and then lift the hips. Squeeze in your bottom, lift the hips. I like to engage the core so that you're kind of rocking that pelvis back. Feel like you're dropping the tailbone down somewhat. Push into the feet a little bit. Feel the effort in the glutes and a little bit in the thighs. And now you're just going to pull out into the strap. So you're trying to separate your knees away from each other and feel how that engages those glutes a little bit more, and just hold that position and breathe. And at the point where you're shaking or you get fatigued, you can always come down and rest. You can do a little bit of pelvic tilting. You kind of want to start with a flat back, press into the arms, press into the feet, squeeze the bottom and lift. Feel that effort in the glutes, and then pull the knees apart, engage the core. Be able to breathe while you're doing it, just really feeling the effort in the hips. And somewhere deep in the hips, we've got these deep hip rotators that are engaging with this exercise. And then go ahead and come down. So how many times do you want to do it? I'm going to do it 3 times. That's a good place to start. Maybe holding the position, 3 to 5 nice long deep breaths. And then as that becomes easier over time, do more repetitions, hold for a longer period of time, progressing the strength of the hips and the deep rotator muscles. One more time, press into the hands, flatten the back to engage your core, lift your hips, squeeze into the bottom, and then pull those knees apart.
You don't want to feel pain at any time when you're doing this. You want to feel effort, trying to discern effort from discomfort or pain. Sometimes effort approaches discomfort because you're like, oh, I'm shaking or I can't do the activity, but is it really painful or is it just something that you haven't done? Trying to really understand the sensations of the body is really important when you're exercising. And then go ahead and come down. Then I just kind of lift my knees. You can take the block out, make the strap a little bigger, the loop a little bigger. Oops, I think mine's locked in here. And take that off. Roll onto your side and come to sitting. So, after this video, take a little walk around. See how those hips feel. Maybe they feel a little bit better. They need support. Your hips need support. And when you're sitting on those glutes and those deep rotators all day long, they are losing their ability to support your hips. So you can do this every day. A little dose of exercise every day to make yourself feel better. But if you want to take this farther, find a physical therapist. Go to the American Physical Therapy Association's website and use the Find a PT search function to find a physical therapist near you who can progress you and take you to the next step, guide you into more exercise with the right dose, the right exercises for you. If you like this video, tap on the bell so that you get alerts every time that I make a new video. Subscribe to my channel so that you can see more of these videos. And I'm Stephanie Carter Kelley, a physical therapist, a yoga teacher. Nice big breath. Namaste.